So, to quickly go over our agenda, we'll have a few housekeeping items that we'd like to share with all of our attendees. Then we will have some introductions of our company presenters, and they will again go into each of their presentations. And then we will have the Q&A session. You will see that there's the Q&A box activated for everyone to include their questions, comments, and we will save those for the end of the presentations. Next slide, please. So, a few housekeeping items. Today's meeting is being recorded. During the meeting, please minimize any of your distractions, background noises, and please remember to keep your mute on mic if you are not speaking. We are encouraging video participation because we love to make this feel like an engaged discussion when each of our presenters are speaking. But as I just mentioned, please use the Q&A box for any questions or comments during today's presentations. We will address the ones we can get to at the end of all of the presentations. Next slide, please. So we're going to let each company present, and in between, I will give a quick introduction or bio to all the guest speakers, and we'll kick off with Quilt Health. So today's speakers are Jasmine Coleman and Jimmy Ola Gary. Jasmine is the co-founder and leads the business development and strategy at Quilt Health. She is a healthcare strategist, operator, and entrepreneur whose career spans life sciences, payer innovation, and digital health. Drawing upon her upbringing at the intersection of community health and entrepreneurship, Jasmine's work is grounded in the belief that innovative healthcare solutions can and must reach the communities that need them most. Prior to co-founding Quilt Health, she held leadership roles at Blue Cross Blue Shield of Massachusetts, Myred Women's Health, and Johnson & Johnson, advancing access to healthcare innovation across clinical, commercial, and community settings. Jimmy is an expert in residence at Quilt Health. He is a Casgevy recipient who has developed a keen interest in the advancements of cell and gene therapies. Since his transformative participation in a groundbreaking clinical trial, he has grown a passion about the positive impact these therapies can have on patients in need and has become a staunch advocate for increased accessibility of gene therapies for sickle cell disease patients worldwide. Thank you, Jasmine and Jimmy, and I'm going to turn it over to you all.
Melissa, thank you so much for that introduction. Hello, everyone. It's such a pleasure to be here today. We are so excited to be a part of the Corporate Advisory Council this year with Six Cells. I know we have 15 minutes and a lot to get through this morning, so let's get into it. You can go to the next slide. I won't spend too much time on my bio. I think Melissa covered it. I will add, like she said, I've spent a lot of time in my career in healthcare, but also in my childhood, given that my mom worked in community health. And so I spent a lot of time at work with her. And so this is where I'm really grounded. I'd also like to add that we have our CEO on the call today, Andy Elner. Andy is a primary care physician by training and really spent most of his career looking at how systems can be improved to drive healthcare outcomes. And before co-founding Quilt Health, he founded Firefly Health, which is a virtual first primary care company you may have heard of. And I won't do Jimmy's intro justice. I know we've gotten through some of it, but I'll hand it to you, Jimmy, to say a bit more.
Thank you, Jasmine. Happy to be here. About 13 years ago, I suffered probably my worst sickle cell crisis ever. It was a cardiac arrest from a simple portacath insertion. It went really, really bad. I was in the ICU for about 2 weeks. And after that accident or crisis, I should say, it felt like an accident because it was avoidable. But anyway, long story. So I needed help. And my parents they really saw that I'd really lost all the fight that I'd had as a warrior. I became a really good fighter. And after that crisis, I had lost all my fight and actually became jaded. And they did everything in their power to make sure that I survived. And accessing a clinical trial was actually what brought me to the other side, to where I'm at right now. And I've become quite passionate about it. I want to make sure that people that live with sickle cell disease globally one day enjoy the same outcome I'm enjoying right now because of the clinical trial I was able to access about 6 years ago. So a friend introduced me to Kilt, and it was like a full circle moment. I'm here because of a clinical trial, and I want to make sure as many warriors as possible, if they can't get access to a commercial drug, they can take advantage of these clinical trials because they can and they do save lives.
Thank you so much, Jimmy. You can go to the next slide. I think he's already said it best. At Quote, we believe, every person living with a complex condition like sickle cell disease should have access to expert care, a supportive community, and innovative treatments. That's the belief that brought our team together. And we've spent the past couple of years since incorporating in 2024 really listening to stakeholders across the ecosystem to inform how we use our time and experience and resources to add value for this ecosystem. Next slide. And a lot of this makes sense with what we already know. We know patients, families, care teams, and community leaders have always worked together. And what's really been missing from what we heard is a place to do so, to a shared place to do so. And so Quilt really is about giving each member of the sickle cell ecosystem tools designed for their role and connecting those tools across roles and regions with one unified record that's owned and controlled by the patient. So, how does all of this come together? I'd like to talk a little bit about what we heard and how that shaped the tools that we're building. Jimmy, can you help me bring this to life a bit? Let's go to the next slide.
Absolutely. So I've actually had a personal experience with hydroxyurea. Obviously, that isn't me. That's an anonymous advisor, but me personally as well. So I was on hydroxyurea as well as a young man, and but for me, my dosage wasn't monitored at all. In fact, I would go for months, maybe even years, without coming back for a test to actually make sure that the drug was doing, in fact, what it said it would do. Now, I'm not going to blame everything on my clinician. That's partly my fault, but that in itself is a problem that the clinician and the patient aren't actually talking. They're not speaking. So that actually creates a wall. And then the purpose of this hydroxyurea that I had gone on, we have no idea what it did, if it did anything at all.
Thank
To
you,
you.
Jimmy. Next slide. So exactly as you're saying, I mean, everyone understands the importance of, like you said, communication and really having access to the team that you need for your care. And not just any team, but expert care. And so whether it's linking people who have never had a specialist or don't currently have a specialist to a multidisciplinary team that specializes in sickle cell, or supporting someone transitioning from one team to another, what we want to do is make it easier for patients and specialists to connect, to find one another, and to have as much context and history at their fingertips as possible from day one of that interaction. And so that's what our Find Care feature really is about facilitating. Jimmy, as our expert in residence, you've shared a lot about, the context that has really informed your experience in your care, and it's really informed what we're building here. Can you share a bit more from your experience? We can go to the next slide.
So in my experience, accessing the clinical trial, I mean, it wasn't rocket sciences, but it should have been easier. Like I said, at this point, I was actually doing the work, not even for myself. I was doing it in an attempt to kind of pacify my parents because at this point in life, I had become jaded with living, if I'm quite honest. And there was nothing. There was absolutely nothing. But I had a tech background and I knew there was a way that I could filter information to come to me directly instead of me having to put the work in. So I used a Google alert on two keywords, sickle cell disease. And at the time I had heard that there's gene therapy. Obviously, sickle cell disease is a single point mutation. So I knew it was a genetic disease. So I put a Google alert on the words sickle cell disease and gene therapy. And to my surprise, after 6 months or so of doing that research, I get an NPR article pop up in my inbox with those two keywords, essentially detailing the fact that the first patient with sickle cell disease had gone through a CRISPR-based gene therapy in a clinical trial. And that is exactly the same trial that I went through that has given me the outcome I'm enjoying today. Um, it was fantastic, but patients shouldn't have to rely or get so creative in order to, particularly patients living with sickle cell disease, that's incredibly complex, incredibly painful. You just want to, all the effort in someone living with sickle cell disease should be getting better, not all the noise around it. And that's why I'm quite passionate about what Kilt's building. And
Thank you,
I'll hand it back
Jimmy.
to Jazz.
Thank you. We can go to the next slide. Um, exactly what you alluded to. Our goal with this feature is really to help patients find and understand trial and treatment options and not, with all of the jargon and overload of information, but in plain language. More importantly, as you also alluded to, Jimmy, we really have a goal of personalizing that view based on your actual medical records and your preferences so that you're seeing not only what you're most likely to be eligible for, but really what aligns with your goals and interests in terms of participation in research and treatment. And in addition to identifying and understanding and having awareness of those opportunities and options, really providing a way for you to save that information so that you can discuss it with your family, so that you can discuss it with your care team, and research really becomes a part of the ongoing conversation, not a surprise or something that only happens, at certain points when you're in interactions with your care team. So hopefully that paints a picture of what we're trying to do with the feature that connects patients to information and opportunities in research and treatment. Let's try one more. Ade Adeokunu is the founder of Sickle, which was the first social network for sickle cell disease, and he's an advisor who's been with us literally since day one. Let's go to the next slide. He shared a bit about his experience. Jimmy, can you take us through this one? Oh, I think you're on mute.
There we go. For sure. So, community is important. I found community actually post-transplant. If I'm quite honest, I never really felt that I had community while I was suffering or in the throes of the disease itself. It was actually post-transplant that I found I was in the need of community. As more and more of us sickle cell warriors are getting gene therapies or disease modifying therapies, there is a community of patients that are coming out on the other side that also have unmet needs. Not as dire as patients that still living with the full-blown disease, but we also have our unmet needs. And I wouldn't be in the place I am today if I hadn't had a community of post-transplant individuals that had gone through some sort of advanced therapy for sickle cell disease to feel comfortable opening up about what I'm going through post-transplant because I felt guilty. Like, listen, I just got a gene therapy that cost $2.3 million for free. I'm not going to complain about my life now, but there were things that I should complain about, and I found community to complain, post-transplant. So huge, very important.
100%. We can go to the next slide. Exactly as Jimmy shared, community is everything. Trusted, safe places to, people and spaces to talk about what's really going on is really important. And some people have that and some people don't. And some people do in one place and then move to another. And so with this feature, we're really thinking about how we can connect people who don't have a relationship with a community-based organization, for example, to a local organization that can offer that peer support, advocacy, and other resources. But also for those who are already connected, we really want to be a part of the engine that ensures that they continue to have awareness of events and resources and opportunities that are most relevant to them. The work these organizations are doing is critical. And we really believe that they need to be included in the same spaces and referral pathways as all of the other stakeholders in the system. And if we can be a part of, the marketing, operational awareness engine that makes sure patients are aware of these opportunities and supports these organizations in doing this work. That's everything this feature is about. Let's talk about one more feature. Jimmy, can you take us through? Let's go to the next slide. Our last lived experience today.
Yeah, if you're doing anything for sickle cell disease, be it drug development or health tech, the goal really is to ease the burden, remove outside distractions so the patient can focus on getting better, getting healed. And post-transplant, ironically, when I had gotten better, I found actually more burden, particularly when it came to actually passing records from my physician to my principal investigator. It almost became a full-time job. Another example is also actually during the clinical trial stage itself, managing the expense report was I actually needed help doing that. I couldn't even take that on my own, on top of the chemotherapy symptoms I was feeling, everything of the anxiety. Imagine having to manage track everything you've had for breakfast, lunch, and send an expense report. And then just it's too much. Your North Star should be making sure that the patient is in a position to get better. And the fact that Kill has this is an exciting future that I can't wait to see one day.
Totally hear you. Like you said, there's a lot that technology can do for us today, and we can go on to the next slide. But there are some things that it can. And this is definitely a place where technology can lighten the load. And that is our goal with this feature, to make it easier to manage your health records so that you can do the things that you need to do with them, whether it's changing providers or finding a provider or accessing a specialist or exploring research, or pulling together documentation for benefits and insurance. um, there's only so much time in a day, there's only so much energy. And like you said, Jimmy, if you are already prioritizing managing your health and what you absolutely have to give your energy to in a day, we really want to think about how we can relieve the burden in areas where technology and our services can step in. And so that's what we're thinking about here. And this really is central to everything we're doing, because it is by getting all of this information as centralized and in one place as possible that we're really able to help it do the jobs that it needs to do, not just, from the perspective of taking the load off of patients, but also just helping to facilitate collaboration within the ecosystem. Let's go to the next slide. I just want to bring this point back because, again, hopefully through these examples, you have a better idea of how what we're building really comes out of what we've heard from patients and how we'd like to support patients. But we, again, are building tools for roles across the ecosystem. And whether it's community organizations or care teams, they both need tools and a space to come together around the needs of the warriors that they're serving. And so as we think about these different stakeholders and how we build to support them, again, we think about where the friction points are and how they're already trying to work together, and how we can bring our time and resources, energy and experience to resolving that, so that all of the work that they're doing can not only be more effective, but reach even more patients that need access to it. Let's go one more slide further. Before we close, I do want to share a bit about how we work in our approach. 3 points I want to get to today. The first one being community has been in the room with us since day one. And I say the kitchen because I don't mean the table, I mean the kitchen. And we could even say the grocery store. This is a really important part about how we build. Whoever we're thinking about, whoever we're building for, that's who we're working with. And it doesn't stop at clinicians, it doesn't stop at sponsors. It really extends across the ecosystem, including patients and community leaders. Second
Yeah.
point, our platform. Oh, did you want to add something, Jimmy?
No, sorry, go ahead.
Oh, our platform is free to warriors. We get that question at times. Our goal is to keep it that way through partnership with like-minded sponsors who give us the resources to connect warriors to clinical trials and treatments. And many of those like-minded, sponsors are in the room today. So there is a lot of energy around making sure patients have access to the resources that they should, the ways that they should, and some of this is, it's going to take everyone in the room deciding that this is the change we want to make happen. Third point, we're not here to sell your medical records. We're really thinking about consent. Consent is what's most important. And whether it's consent to participating in research, consent to sharing your records with the provider, it really is about us building in a way that leaves that choice with the patient who owns the information. Um, I'll kick it to you, Jimmy. Did you want to add something?
Yeah, yeah. I wanted to let you finish. I didn't want to interrupt you, but I
Oh,
wanted to really double click on that community being in the kitchen for from day one. I've had the opportunity to be an expert in residence with you guys, and I wear multiple hats. I help on the strategy side, I help on the marketing side, and all of them are important, and they all play a role in getting patients what they need. But by far my favorite is the product. When I get back there with the product team and I look behind the curtain and I see the feedback that I've given or other members of the community have given and being implemented, I get excited. I really get excited. While this is not an advanced therapy or a disease modifying therapy, it's another tool in the tool belt for improving the lives of patients that live with sickle cell disease.
100%. Really appreciate that feedback, Jimmy. Thank you. We have one more slide. I know we are at time. We will be at the next couple of show and tells as well. So you will see us again. This is really an opportunity for us to make sure those who didn't know Quilt get to know Quilt, and those who have an understanding of what we've been working on to date. Would you go one slide further, Abby? Thank you. So for anyone who, if you are a warrior with sickle cell disease and you're interested in early access to the product, please use the QR code on the screen. If anyone else just wants to stay connected, there's a QR code for our newsletter. Any CBO leaders in the room, providers, sponsors, please find me directly, jasmine@quilthealth.com. And again, we'll see you again at the next couple of show and tells. Really want to just thank Six Cells again for providing this platform and this forum. Thank you all.
Thank you so much, Jasmine and Jimmy, for this outstanding presentation from Quilt Health. And as a reminder, please use the Q&A box at the bottom of your screen to share any feedback, comments, or ask any questions, and we'll address as many as we can at the end of the presentations. Transitioning to our next guest speaker, on behalf of Genetics Biotherapeutics, we have Jeraine Willoughby, who serves as patient and community educator at Genetics. With over 20 years of experience in the healthcare and pharmaceutical sectors, she is committed to fostering strong relationships and providing education and support to patients, enabling them to make informed healthcare decisions. In her capacity as a patient and community educator, also known as PACE, Drain offers a range of patient-focused educational services and resources, which cover their products, gene therapy, and sickle cell disease. PACE does not offer medical advice or recommend specific treatments. However, their educators, such as Jeraine, look forward to engaging and assisting the sickle cell disease community. So, Jeraine, I will turn it over to you. Thank you for joining us today.
Thank you so much for having me, Melissa, on behalf of Genetics Biotherapeutics. As already stated, I am Jeraine Willoughby. I reside in St. Louis, Missouri, and we are extremely grateful to the Sickle Cell Organization and each and every one of you for allowing us to join today. You can go to the next slide. And you can go to the next one from there. Sorry about that, since we've already covered that. So in our discussion time today, this is going to be an abbreviated presentation that I would normally give. As you can see, here is our agenda. We'll introduce you to who Genetics Biotherapeutics is, talk about gene therapy for sickle cell disease, and specifically Lyfgenia. We will discuss the important safety information before going through the clinical study design and results, as well as the treatment journey for Lyfgenia and eligibility and our patient support services. Next slide. So, okay, you all have the original one that has bills, so you can start pressing the button. This is not the second one that I had sent over. But anyway, so at Genetics Biotherapeutics, we are a gene therapy company. That's all we do. We are the only organization that has three FDA approved therapies, gene therapies for patients living with rare genetic diseases. So that is our focus. One of them, of course, is gene therapy related to sickle cell disease. We have over a decade of research and development behind our gene therapy for sickle cell disease. And with that, each and every step of the way, we have been in partnership with the sickle cell community. We are proud of our relationship and will continue to build upon that. In our clinical trials, we are thankful to each and every one of the sickle cell warriors that participated. Because of them, we have been able to continuously make improvements to our gene therapy, and we are committed to patients and their families. We provide support that never stops, and that means we provide comprehensive health for travel, access, and other resources for patients and families each step of the way. Next slide, please. So, as you all know, there are three commonly used treatments for sickle cell disease. Of course, you have your disease modifying therapies as well as blood transfusions. These offer some relief for pain crisis and deal with the day-to-day symptoms of the disease. Unfortunately, it does not address the disease at the genetic level. Next is stem cell or bone marrow transplants. And these are one time treatments that are deemed to be curative in nature. They're recommended for patients generally under the age of 16, and they do require an ideal match, meaning a sibling or a parent in some instances, which is something that many warriors do not have access to. Now, advancements in treatments have been made through gene therapy. They are one time treatments that are designed to treat sickle cell disease at the genetic level, and they do have the potential to eliminate or reduce vaso-occlusive events, including pain crisis. Next slide. So in 2023, December, as a matter of fact, the FDA actually approved two different gene therapies for sickle cell disease. They both allow patients to use their own cells and do not require a donor. Gene editing is designed to treat sickle cell disease by turning off that part of the DNA that tells the body to stop making fetal hemoglobin. When this happens, the body will in turn make more fetal hemoglobin, which can help prevent sickling. Gene addition is designed to treat sickle cell disease by adding a healthy copy of a gene. It gives the body a working copy of the hemoglobin B gene. This helps to make a working copy of adult hemoglobin, which can prevent sickling and vaso-occlusive events. Next slide, please. Next. So that brings us to Lyfgenia, which is a gene addition therapy that treats sickle cell disease at the genetic level. Next slide. And Lyfgenia is the longest studied gene therapy for sickle cell disease that has been approved by the FDA. We have, again, more than a decade of research and development behind the treatment. It is made specifically for you using your own cells, so there is no donor needed. It is indicated for patients who are 12 years of age who have a history of sickle cell disease, sickle cell crisis, including vaso-occlusive events. And it works by using a well-studied delivery system that gives your cells new instructions on how to make working hemoglobin that does not sickle. This can help to reduce or stop sickle cell crisis. Next. So let's talk about sickle cell crisis. So, as you all know, it is a lifelong genetic disease that is marked by unpredictable and progressive symptoms that caused by sickle cell crisis. It is painful, and as a result, red blood cells block the flow of blood. This is known as a vaso-occlusive event. In the Lyfgenia clinical study, we looked at both the vaso-occlusive event and those that were deemed to be severe in nature. So the vaso-occlusive or sickle cell pain crisis was defined as followed: events that required a visit to a medical facility, an episode of acute pain for vaso-occlusion that lasted over 2 hours, acute chest syndrome, which was a blockage of blood vessels in the lungs, or points where blood is trapped or pools in the liver or the spleen. The severe vaso-occlusive event Was any of the following events that required hospitalization or multiple visits to the ER or urgent care in a 72-hour period, where IV medications were administered each visit, or priapism that required any level of medical attention? Next slide. So, as a result, sickle cell crisis or vaso-occlusive events can result in blocked blood flow that leads to severe pain, frequent ER visits and hospitalization. It causes a disruption to the daily life, meaning how patients function at school, work, and with their families. And unfortunately, it can cause a risk of long-term organ damage. Next slide. So before we go into the clinical study, design, and results, we have to highlight the important safety information. So at the time of the initial FDA approval, 3 patients were diagnosed with blood cancer. 2 of the patients were treated with an earlier version of Lyfgenia that used a different manufacturing process and transplant procedure, and 1 of the patients had alpha thalassemia trait. Treatment with Lyfgenia may increase your risk of developing blood cancer, which can be life-threatening and or cause death, and can develop many years after treatment with Lyfgenia. I'm going to provide more context to this statement as we go into the study design and results. Next slide, please. Next slide. So, as the longest studied gene therapy approved for sickle cell disease, this is what the study design looked like. There were 45 patients in the trial that were evaluated for safety. The median age of patients was 25, with the youngest being 12, the oldest being 43. However, there is no upper age limit for treatment with Lyfgenia. The median duration of follow-up was 42 months. Next slide. And this is going to be a build again, so you can start pressing through. Thank you. So this is what the clinical trial protocol actually looked like. As you can see, there were 45 patients that were broken down into 3 different study groups. The safety, again, data comes from the 45 patients that were in the clinical trial outcomes, as well as the safety from the long-term follow-up. The efficacy comes from the patients that were in group 1C. Those 36 patients actually underwent the exact same treatment protocols that patients receive today with cell collection, transplant, and manufacturing process. So this is again a build you can press through. Into the next slide, please. Okay, so again, going back to that important safety information, one of the things I want to point out here when we talk about the ISI, study 1A, that's the beginning part of the trial, that 2 individuals treated with an earlier version of Lyfgenia, which used a different manufacturing process and transplant procedure. They developed acute myeloid leukemia and unfortunately did pass away during the clinical trial. In study 1C, which was the latter part of the clinical study, 1 individual with alpha thalassemia trait was diagnosed with myelodysplastic syndrome. This led to the limitations of use for individuals with alpha thalassemia trait and for individuals with more than 2 alpha globin gene deletions. So it's important to note that individuals living with sickle cell disease have an increased risk of blood cancer as compared to individuals without sickle cell. And gene therapy can be very stressful on the body and on the blood system. The bottom line is your safety is a priority. That's why long-term follow-up is an important part of treatment journey with monitoring at least 6 months for a minimum of 15 years. Next slide. So, how did Lyfgenia do from an efficacy standpoint? Again, it is a one-time transformational therapy with the potential to decrease or stop sickle cell crisis. In the clinical trial, again, 36 individuals were evaluated for efficacy. Of those 36, 32 actually had a history of at least 4 or more vaso-occlusive events in the 24 months prior to the clinical trial. Those patients were then evaluated over a period of 6 to 18 months following treatment with Lyfgenia to see what type or what the numbers of vaso-occlusive events were that they sustained. As you can see, 88% of the patients did not experience a vaso-occlusive or sickle cell crisis following treatment with Lyfgenia. And 94% of the patients did not experience a severe vaso-occlusive event following their treatment with Lyfgenia. So, one of the things that separates Lyfgenia from other gene therapies is that it is the only approved gene therapy for sickle cell disease where patients were actually checked for sickle cell crisis due the exact same time frame, which was the 6 to 18 months following treatment. This was done to ensure patients are evaluated in the exact same way. Next slide. So let me show you what this looks like from a visual standpoint. And this is going to be a build again so you can start pressing through. So as you can see on the left side, this is what we call a swimmer's plot. This is not in the prescribing information, but this shows 32 lanes, which represents the 32 patients that were in the clinical trial. The white circles are regular sickle cell crisis or vaso-occlusive events. The darker circles represent those that were deemed to be severe. As you can see, many of these patients were suffering with a number of crises on a monthly basis. Some had one or more each month for the 2-year period of time. In the middle, the line down the middle shows when the patients received their treatment with Lyfgenia. And as you can see to the right, 18 months prior after treatment, you can see just how few incidents the patients actually sustained once treated with Lyfgenia. So again, transformational results for patients that were treated with Lyfgenia. I also want to highlight the fact that there was no clinically meaningful difference in efficacy or safety for patients that were adult age as well as those that were adolescent. Next slide. Another differentiating factor for Lyfgenia is that we actually have stroke data. There were 5 adults who were over the age of 18 years and older who had a history of stroke and blood vessel problems that were receiving chronic blood transfusions before Lyfgenia. Following the treatment, all 5 no longer needed blood transfusions and have remained stroke-free for a period of 4 to 5 years post-treatment. Next slide. And this is a build again. So, following the treatment, 20 patients were analyzed to see how they continued to do following their treatment with Lyfgenia. And as you can see on the slide, when it came to pain intensity and pain fatigue, what patients had to say. 57% of the patients reported improvements in their pain. Pain interference, 64% of the patients reported improvements in how the pain interfered with their daily lives. And from a fatigue standpoint, 64% of patients reported improvements. Next slide. Okay. So as you can see here on the screen, because I know I'm running out of time, there is a QR code. So you can go pick up your phone, utilize that to go to lyfgenia.com, where you will find everything in regards to the prescribing information and everything that I would discuss in this presentation. But just quickly to walk through the treatment journey, we have 6 steps to the treatment journey. Step 1 is a conversation with the healthcare team at a qualified treatment center. And this is a medical facility that has been trained on how to properly administer Lyfgenia. Step 2 is the stem cell collection, and that is mobilization, process of moving blood stem cells into the bloodstream, and then apheresis is the actual collection. Step 3 is when Lyfgenia is created. So a modified copy of that beta globin gene is added to your cells. And then at this point, that's a 10 to 15 week process, but the patient is at home living life. Following that is, sorry about that, step 4, patient comes back in, conditioning chemotherapy, and this is done to make room in the patient's bone marrow to receive their stem cells. And then step 5 is the Lyfgenia infusion. And then the step 6, recovery and long-term follow-up, 3 to 6 weeks. It depends upon the individual patient and the qualified treatment center, how they like to handle that. This also gives them a time to set up their protocol for their 6-month check-ins over that next 15 years. Next slide. You can go through again, just go to the next. because I want to make sure I just mention the patient support services right quick. Next slide. And that's a bill. So to conclude, because I know I'm out of time now, we have our patient support services. And as I mentioned before, we provide true patient support that never stops. So our patient navigators are provided free of charge, and you do not have to have a prescription to utilize their services. You can see the QR code on the screen. They are there to offer ongoing help before, during, and after treatment. They connect patients with qualified treatment centers and assist with travel and lodging. They can help guide insurance and financial assistance conversations. They can also help to provide resources that support fertility preservation. And most importantly, they actually can connect warriors with other warriors for Lyfgenia that have actually gone through the process. So we have a peer-to-peer support. This gives patients who are considering treatment with gene therapy or with Lyfgenia an opportunity to talk firsthand with someone who's already taken their journey. Next slide. So this is some of the additional resources you can find on our website. Please utilize that QR code and you can find more information. So I thank you all for the time today.
Thank you so much for this presentation, Jeraine. And again, please feel free to drop any questions or comments in the Q&A box regarding their presentation. Thank you so much for your time.
Thank you.
We are going to do a quick tech behind the scenes and then transition to our next guest speaker. So our next speaker will be Janie Davis, who is the Director of Global and Patient Advocacy at Agios. She serves as the Director of Global and Patient Advocacy, as mentioned, bringing more than 25 years of distinguished experience as a pharmaceutical executive. Her expertise spans patient advocacy, brand strategy, and tactical execution, new product launches, life cycle management, and the nuanced engagement of both healthcare professionals and patient audiences. Over the past 4 years at Agio, she has worked in partnership with patient communities worldwide, continually engaging and educating to better understand their challenges, obstacles, and achievements on a global scale. I welcome to the stage Janie Davis.
Hello, thanks so much, Melissa. Uh, and I want to thank Six Cells for inviting Agios to participate in this opportunity with your for our corporate advisory council members as well. So next slide.